At the University of Mississippi Medical Center, transplant surgery is almost routine. For patients like KJ Page, a new heart means a new life. But 50 years ago, it was a different world, and Mississippi was a different place. On June 12, 1963, Dr. James Hardy and a team of surgeons transplanted a human lung into the chest of 58-year-old John Russell, a prisoner at the Mississippi State Penitentiary at Parchman. Russell had repeated bouts of pneumonia, a right lung weakened by advanced emphysema, and a left lung rendered all but useless by cancer. The transplant surgery would be the first of its kind in the world. But the assassination of civil rights leader Medgar Evers would be the headline.
It's really kind of ironic that both those events actually happened simultaneously. I mean, Medgar Evers was murdered while Dr. Hardy was doing the lung transplant. Dr. Hardy was responsible for at least two of the really seminal events in surgery, and many people are surprised to find out that those two events, happened here in Mississippi. But certainly the lung transplant was probably the most important. He did the world's first lung transplant, and that was a major feat. It's actually more difficult to do a lung transplant than a heart transplant, so it was interesting that he did the first lung transplant before he did the first heart transplant.
The staff didn't know it was a first, universal, because I guess he didn't want us to know. I don't know why we didn't know, but it just went on just like any other routine procedure.
Joyce Sarasi was there for both transplants, the lung in '63 and the heart in January of '64.
Was it a difficult surgery from what you remember? I mean, was it?
No, everything went well.
It was really well thought out. There was a lot of work before the transplant. He was very careful in which patient he did it in, and the transplant worked. I mean, the patient died of kidney failure. He didn't die of lung failure. The patient died of kidney failure 19 days after the operation.
And we put in the lung. It functioned beautifully for, I think he lived 19 days, but they had renal failure when he came, and he died essentially of inanition and renal failure. Yes. But it worked beautifully, so after all, we had no hesitation.
Transplantation was just coming into its own, and this was a big step forward, particularly for a human. They had done this in the animals, the laboratory, and Dr. Hardy was just a pioneer. He said the time has come and the opportunity was there, and he was an excellent technician and could get things done, and he took the step forward and did it.
It was a complex confluence of events. A troubled time, an economically not wealthy state, but a man with a vision and a strong personality, and paradoxically, a legislature that had been very generous in establishing a quality university hospital that was able to attract the people who made these events occur.
The heart transplant was a little bit more controversial because it was putting a chimpanzee heart into a man. So that didn't get as much positive feedback as the lung transplant, but it was also another really landmark feat because he actually showed that technically the operation could be done.
There's no doubt it was a very seminal event in the development of the field of transplantation, of heart and lung surgery, including open heart surgery. The job of each subsequent generation is to stand on the shoulders of the previous and to accomplish even more. And if we're not doing that, then we're not doing our job. And everyone here at the medical center is very aware of that role.
50 years after he did the first lung transplant, and a decade after he passed away, I can't go to a national meeting without somebody asking me about Dr. Hardy.